the violence, the level of violence in many of the African countries was significantly higher.
Can you elaborate in terms of if you can draw some parallel between while working at a women's university in Mumbai and also exploring multiple countries within African subcontinent, that what are similarities in terms of health or health challenges people were facing?
So in India, we have disparities in health. So although I was in Mumbai, I was in a place where women could have an education. And this was a women's university that was started, one of the first women's universities where they really wanted to empower women to have an education and actually higher education. It's not enough to have a primary education. It's not enough for secondary education, but to have a tertiary education so that then they can be empowered and join the workforce. So I found that. But there are disparities in health even in India that I saw, because I studied to be a food scientist and a food technologist. And what I realized is the disparities in women's health. So India bears the burden of women's anemia in the world. Lots of Indian women are anemic. Women, the girl child in the first 1,000 days, that is first 3 years, might not have adequate nutrition. And that means it results in stunting throughout their lifespan. It gives rise to low birth weight babies to those mothers. At the same time, with women's health, at that time, I'm talking about late 80s and early 90s. At that time, still there were cultural issues that were there. India is still quite a patriarchal society. So for women, even though in Mumbai, women worked, at the same time, they traveled long distances for work. They had challenges when they had to manage work and house and children. We still heard about dowry debts. We still heard about sex-selective abortions in India. The HIV pandemic was also starting. It started in the United States, where it was very much homosexual, whereas in Africa it was heterosexual between partners. And in South Asia and Southeast Asia, in countries like Thailand, Indonesia, Philippines, India, it was also heterosexual. So I learned about all these issues. And one of the things that I saw is like dowry debts, the impacts of dowry, family and domestic violence issues, and often not enough legal safeguards for women to be able to actually leave a challenging family situation for the sake of the children, for economic reasons or financial reasons. So that was there. In Africa, it was totally different. In Kenya, what I found was, what was confronting for me was the huge number of street children. Like, you do see poverty in India because you do have the slums in the big cities. You have that disparity. But everyone tries to work. The children are with the parents in some ways, even in the poor households. But here, these children had been abandoned. They were in the streets, and that was quite confronting. The violence, the level of violence in many of the African countries was significantly higher than what I had experienced in a city like Mumbai. At that time, police still had batons, they didn't have guns, whereas there you saw soldiers on the streets, you saw the police, and you also saw the challenges that come with severe disparities. So you had security guards, you had dogs, and all of that. That was what I saw in Kenya. But it was also formative years for me. My son was born in Kenya, and at the same time, I moved from higher education into primary education because it was opportunistic. I was going to have a baby. I was there. There was an international school. There was a malaria research center. And I got this wonderful opportunity for 2.5 years. That was excellent. So I met people from all over the world. There was a USAID scientist who were doing malarial research. Again, I was exposed to malaria. I was exposed to HIV, which I was not in a big way in India.